Unfortunately, really not much. Due to privacy, patient privacy and privacy laws, the state of Iowa will not release any information that would personally identify the patient. All they tell us is you have a positive in your county. I know people would like to know, but the way the system is set up, you really can't. The public health department here does know who this patient is and is following up with them, checking in with them every day, sometimes twice a day. I understand that they are at home, so they're going to call and ask about symptoms or fever or anything like that. They're also doing what's called contact tracing, in which they find out who the patient may have been exposed from and also who they may have exposed. In that way, if somebody does end up getting sick, then we know the route, the way the disease was passed on. But that's really all we can say. Yes, we do. We are still operating our dedicated respiratory clinic, which is sealed off from the rest of the clinic by an air system. They're open every day, Monday through Friday, seeing an average of between 6 and 10 patients a day for the last couple of weeks. We're still offering testing to people that meet the guidelines. And so, yeah, we're still being very proactive. One of the things that we don't want to do, but we may end up having to do if we do see person-to-person spread inside our county, is we may have to go to an even more strict level of visitor restrictions in which nobody can visit somebody in the hospital. We do that to protect our patients. The only exceptions are going to be the birth partner of an expecting mother, and for hospice patients, we are making exceptions for those. IDPH, they have their strike teams, their testing strike teams that they send out to hotspots. They've mostly been concentrating on food production facilities, since that seems to be where we have a high rate of spread for some reason. But they're also opening up 2 new Test Iowa sites starting today. None of them are super close to us. The closest one I saw today was Denison, but I do expect that at some point in the future we'll have one relatively close to us, so anybody that's taken the online quiz and has been recommended for testing will be able to be tested. Every time something significant happens, we push it out on our Facebook. We also try to keep our website fairly up to date. So other than leaning on us for information, my best recommendation is the Iowa Department of Public Health. They actually launched a whole new website just for COVID-19. The data and information was getting to be so big they couldn't keep it incorporated in their own website. So they actually created a whole new website. But you can still find it under the Iowa Department of Public Health. There's a nice big blue tab that says COVID-19 information. And they actually break it down really well. They show how many people have been tested, how many people have recovered, how many people are, if you go down, there's 2 tabs. One's total case count. That shows statewide. There's a map of every county and how many positives. They never drop off. That is totally cumulative. So even if the person in Palo Alto County recovers and is never hospitalized, we're always going to have at least 1 positive case. But then they break it down even further into regions and Regional Medical Control Center. I'm not sure exactly what they call them, RMCC. They break it down, and in our area, for instance, right now, as of yesterday, 79 people are in the hospital for COVID-19. 38 of those were in the ICU. And over the last 24 hours, 4 people have been hospitalized for COVID. So they break it down really well. The only problem with our MCC is it includes Sioux City. So a lot of our numbers are actually Sioux City numbers. When you get out towards us, Emmett County still doesn't have any positives. We have the 1. The rest of the counties surrounding us are in single digits. So I think the numbers are skewed a little bit towards the urban side. If you do have any questions that you haven't been able to find an answer for, I'm more than happy to help out. Just comment below, and it will get the information to me and I will find an answer.